I'm Dr. Hind Hafsi. I'm a researcher in the Institute of Cancer Research in Professor Kevin Harrington's lab. Radiotherapy is one of the most common treatments for head and neck cancer patients. It works by damaging the DNA of cancerous cells, but the problem is that cancer cells are able to repair themselves. So this research is about finding ways to prevent cancer cells from repairing themselves. So what we want is to enhance the effect of radiation by combining it with targeted drugs. And for that, we are going to use anti-cancer agents that turn off the DNA repair in cancer cells, but allow normal cells to survive. And we are able, with targeted therapy, to adapt the treatment to a specific patient. The strategy here is just to block two main proteins in the cancer cells to make sure that it will promote cell death. So in my project, I'm using two different drugs that I'm going to call drug A and drug B. When I use these two drugs, I need first to assess their toxicity, and then I need to put them together and see if they are working well, which means killing more cancer cells. Here you can see that in purple the cells are not dying, and then in presence of the two drugs the cells go clearer, so almost white transparent, so then I can see that the two drugs are very efficient in killing cancer cells. What I want to do next is to see that in presence of radiations these two drugs are working more efficiently, which means killing more cancer cells. As you can see here, in presence of drug A and radiation, there are less cells alive, as well as in presence of drug B and radiation. But in presence of the two drugs and the radiation, so in presence of the triple combinations, there are almost no cells remaining. To conclude, I've been able to demonstrate to you that these two drugs together are synergistic and are working very well. Both drugs with radiation is a very efficient combination. With this impressive result, we are confident that this could lead to more effective treatment for head and neck cancer patients. The first step towards this is a clinical trial, but overall, this research could lead to a significant improvement in survival rate for head and neck cancer patients.